If you've been working with doctors for years and you're not getting any better, there's a reason for that. And it took me 20 years inside the system to finally understand what it was. I'm a pain management doctor with an insurance-based practice, thousands of patients, and somewhere around year 15, I started seeing something I couldn't ignore anymore. Something that eventually made me want to transition away from everything I'd built. The same patients kept coming back, but with different problems. I fixed their pain, and 2 years later, they show up with digestive issues, energy crashes, or brain fog. Some would start on 5 medications and eventually be taking 11. It was like the health problems never stopped. They just changed. These were people I'd helped physically. So why were they still getting sicker overall? I'm Dr. Savir Rao, triple board certified in anesthesiology, pain medicine, and functional medicine. I've treated over 20,000 patients across my career. And the answer to that question wasn't hiding in their medical charts or their MRI scans. It wasn't even the lab results I was ordering, because traditional labs only show you a narrow window of normal. They don't catch the deficiencies that are slowly breaking people down. So I started looking beyond what I'd been traditionally trained to see, and what I discovered completely changed the way I practice medicine. I want to walk you through what I saw, why it matters for you, and what actually works when the conventional approach stops delivering results. For 20 years, I worked inside traditional medicine. Everything about the system told me I was doing it right. My job had a clear outline. A patient comes in with pain, I diagnose it, I treat it. One intervention after another, one procedure after another, one medication after another. Traditional medicine has a protocol for pain, and I was really good at following it. But the system itself doesn't ask the deeper questions. Why does this particular person have chronic pain? Why do they hurt when nobody else in their sport does? How did they heal wrong? What actually broke down underneath all of their symptoms? These questions require time. They require testing that the insurance companies often don't cover. They require thinking beyond a standard protocol. The traditional model is simple. Here's your diagnosis, here's your treatment, next visit. It doesn't stop to ask something more important. What is this person's body trying to say? The moment I saw this gap, I still remember this like it was yesterday. My wife, a pediatric gastroenterologist, calls me in the middle of a busy patient day. I remember thinking, she's seeing her cardiologist, must be important, let's pick up the call. What she told me right then blew my mind. 2 months after delivering our first baby, she apparently had developed a serious heart condition leading to heart failure. The cardiologist told her she would have to stop breastfeeding, get on meds, get a defibrillator, or she may die. Now, just the day before, she was carrying our daughter, dancing up a storm at a reception. We were both very confused and terrified at the same time. So we got a second opinion, which actually came back worse than the first one. So we followed the instructions and did the traditional medicine approach for a year without any real improvement in her heart function. We then turned to functional medicine and had her undergo a very thorough evaluation and multiple diagnostic tests that had not been performed before. She actually ended up with 5 more diagnoses, but the doctor said he was confident that he could help her. He described a detailed treatment protocol consisting of supplements, vitamins, and nutrients, in addition to her normal traditional medications. He told us that her heart failure or heart muscle was inflamed and starving for the right type of energy blocks, and with this protocol, she would be able to be good to go in a few months. We were both floored by what he was saying made so much sense to us from a physiological and pharmacological standpoint. Considering we had both been very specialized physicians, having spent almost over 20 years of training after college between the two of us, and neither of us had heard of anything he was suggesting. They just didn't teach the stuff in medical school or residency at that point. Sure enough, her heart function did improve, just like he said it would, and within a year, her heart ejection fraction was back to normal. I was amazed and so curious to learn more. I went and did a fellowship at A4M and got board certified in functional medicine and started Shakti Health and Wellness Center with my sister, an internal medicine doctor who'd been practicing functional medicine for years. In my studies, I realized that the root of all evil in our body is inflammation, the same condition that causes so much of our pain in our bodies. It dawned on me that treating chronic pain through a functional approach was a no-brainer, since it would allow us to get to the root cause of what's causing these underlying problems. The problem was that in traditional medicine, I had options. I could prescribe pain medications, sleep medications, anti-inflammatory medications. but I was never asking the question that mattered. Why is their body in this state in the first place? What's causing all of this inflammation? What's missing from their system? Why aren't we seeing it? I had the knowledge to fix individual symptoms. I didn't have the framework to find what was actually causing them in a traditional setup. What do conventional labs miss? Well, this is where things get serious. Traditional labs show you a narrow slice of information. They tell you your cholesterol looks normal, your blood sugar looks normal, your thyroid looks normal. But normal just means you're not sick enough to need emergent care. It doesn't mean your body is thriving. You could have vitamin and mineral deficiencies that are draining your energy. You could have mineral imbalances affecting your mood and how you think. You could have that inflammation simmering under the surface, aging your joints and your heart. Your hormones could be making it impossible to lose weight. And standard labs won't show any of it. They may come back as normal. When I learned functional medicine, I started ordering different types of tests, advanced micronutrient panels, detailed organ function analysis, complete hormone pictures, inflammatory markers, genetic risk factors, and heart rate variability testing. Suddenly, I was seeing the whole picture, the whole story in the whole body. That moment made it clear to me. Traditional medicine wasn't letting me down, it was letting my patients down. If this is making sense to you, subscribe. I'm building a complete picture of how I actually assess patients, figure out what's really going on, and create treatment plans that work. You'll want to see what comes next. After 15 years, I made a choice. I could keep practicing the way I'd been trained traditionally. I could keep helping people manage their diseases. I could keep writing prescriptions and doing procedures. Or I could do something different that actually makes more sense. I chose the second path. I became board certified in functional medicine and anti-aging medicine. I opened a second practice called Shakti Health and Wellness Center and built it from scratch with my sister around finding root cause, using regenerative therapies, and focusing on longevity. The results were completely different from what I'd been seeing using a traditional technique. When we talk about transformation, there's one patient I routinely think about often. A 50-year-old executive who was overweight, always stressed, completely exhausted. His health markers were in terrible shape. He felt trapped in his own body. He'd already tried everything traditional medicine had to offer. When he came to me, we did what the conventional system couldn't. We looked at the full picture, his nutrients, his hormones, his inflammation, his gut health, his way his body was processing food. Then we treated what was actually causing the problem. 6 months later, he lost 40 pounds. His cholesterol numbers normalized. His energy came back. His mental clarity came back. He was in the gym lifting weights again, and he told me he felt like he was 30 years old. You can't make that happen with traditional medicine alone. Here's what I've learned through all of this. Your body isn't trying to hurt you. It's trying to tell you something is wrong, and you should listen. Managing disease is completely different from reversing it. You can feel fine now and still be declining at the cellular level. Finding root cause requires advanced testing and actual thinking, not just following a protocol. When you fix what's actually broken, the symptoms go away on their own. Tonight, I want you to pull out your most recent lab results and just think back to the last doctor's appointment. Ask yourself, did anyone explain why your numbers were the way they were? Did anyone ask about your nutrition, your sleep, your hormones, your stress load? Write down the questions nobody has ever asked you. Those gaps are exactly where the functional medicine approach begins. And that list is what I'd want to see at the first appointment. 20 years ago, I believed the system had all the answers. I've learned that system has real limits to what it can do. But more importantly, I know what's on the other side of those limits. Functional medicine, regenerative medicine, root cause protocols, testing that can actually show what's broken, treatments that fix instead of just managing them. If you want to understand how I actually figure out what's causing your pain or your decline, watch this video. What 20,000 patients in 20 years in chronic pain medicine taught me that I'm not supposed to say aloud. It walks you through my entire assessment framework. Watch that next.